Let me ask you something right now. Why is it that some cancers, when caught early, people survive, but when it comes to pancreatic cancer, the story is often different? So today we'll be talking about one of the most feared cancer out there, one of the most deadliest cancer in the world, and that is pancreatic cancer. Now I'll be explaining why it's considered deadly, what makes it different, and most importantly, how you can spot this cancer early enough to do something about it. And if you're coming across my channel for the first time, you are so welcome. My name is Uche Chichezendo, a clinical physiologist. Here we make educational health content. If it concerns your body, we gist about it. Now hit the notification bell so that anytime I post a new video, you'll be notified. Now let's get into business. For this video to continue, we really need to understand the basics now. We need to understand what the pancreas actually is, its function. The pancreas is a small organ that sits deep inside your abdomen behind your stomach. Now we need to understand how important the pancreas actually is. The pancreas plays two major roles, and one is for digestion. It helps to digest food, and the other is that it helps to control blood sugar by producing insulin. We all know that insulin is a hormone that helps to regulate blood sugar. What insulin does is that it facilitates the uptake of glucose from the bloodstream into the cells. So the function of the pancreas, the beta cells of the pancreas, is to produce insulin. So the pancreas is very, very important. Take note of that. For you to understand how deadly pancreatic cancer actually is, I'm going to give a brief rundown on its function when it comes to digestion. Now, for instance, I'm going to take digestion of carbohydrates. Digestion of carbohydrate actually starts from your mouth. Now, in the mouth, we have the salivary amylase. It's an enzyme that helps to break down your carbohydrate, because when you chew, that complex starch breaks down to maltose. After that, it travels through your esophagus into your stomach. When the food reaches your stomach, there's not much of digestion of carbohydrate that takes place in the stomach. This is because the acidic nature of the stomach, which is a hydrochloric acid, stop the salivary amylase from working. You understand? So from the stomach, food is pushed to the small intestine. The first part of the small intestine is the duodenum. Now, this is where the pancreatic amylase comes in. Listen up. When food reaches the small intestine, the pancreas releases pancreatic amylase that breaks this further, that breaks down this starch further into simpler sugar, which is known as glucose. In the smaller intestine, which is the small intestine, is where absorption takes place. This glucose is absorbed in the intestinal wall into the bloodstream. Now, you agree with me that the pancreas is very, very important. Its role in digestion, its role in blood sugar control. That is why pancreatic cancer is one of the most deadliest cancer in the world. Pancreatic cancer happens when abnormal cells in the pancreas begin to grow uncontrollable. The most common type is called adenocarcinoma, and most importantly, it is very, very aggressive. Pancreatic cancer has one of the lowest survival rates compared to other type of cancer. And here's the scary part. Most people don't even know they have this cancer until this thing has already eaten them up, it's already advanced. I'll be breaking down 5 reasons why pancreatic cancer is considered one of the most deadliest cancer in the world. And number one reason is that it hides deep inside the body. Pancreas sits deep inside your abdomen, just behind your stomach. So tumors can grow for a long time, even without being noticed. No lumps, no visible swelling, nothing too obvious, and that makes it one of the most deadliest because it cannot be detected early enough. And number 2 is that symptoms shows up late. Unlike other type of cancer, early pancreatic cancer is usually silent. Before symptoms start to show, this cancer might have already spread. And the next reason is that it spreads quickly. This cancer can spread so fast. Pancreatic cancer is very, very aggressive. It can spread to the lungs, the liver, the nearby blood vessels. And once that happens, treatment becomes much harder. And number 4 reason is that it's very, very hard to detect pancreatic cancer early. This is because we don't have a simple screening test that can actually spot out this cancer early. When we say pancreatic cancer is hard to detect early, we are talking about one major issue. There is no simple screening routine test for it. Now compare that to other cancer. For instance, for breast cancer, we have mammogram, while for cervical cancer, we have pap smear. These tests are easy to do, affordable, designed to detect this cancer even before symptoms start showing. So what's the difference with pancreatic cancer? In pancreatic cancer, no reliable early screening tests. There is currently no test doctor can give a healthy person that can confidently say that yes, this test can detect pancreatic cancer early. There are blood tests like CA99, but here is a problem. It can still show normal even when the person has cancer. It can also be high in non-cancer condition, so it's not reliable for screening. Lastly, this cancer is resistant to treatment. Pancreatic tumors are known to resist chemotherapy and other treatments. This makes it more difficult to control. Now, for the symptoms of pancreatic cancer, you should not ignore. You have to listen in this part. Even though symptoms usually comes late, there are warning signs you should watch out for. And number one is abdominal pain or back pain. If you experience unexplained weight loss or maybe loss of appetite, yellowing of the skin and eyes, that's enjoying this, dark urine, pale stool, new onset of diabetes, especially in adults, that's sudden diabetes. Remember, the pancreas is the one responsible for producing insulin. So this insulin helps to control the blood sugar. So if you notice sudden diabetes, like new onset of diabetes, especially in adults, that could be a warning sign of pancreatic cancer. Now listen, let me emphasize this. Having all these symptoms does not automatically mean that you have cancer. But if all these symptoms I mentioned now persist, please go and check it out early. How is pancreatic cancer diagnosed? Listen up. If a doctor suspects that you may have pancreatic cancer, they may run several tests, which includes imaging tests like CT scan or MRI, ultrasound, especially endoscopic ultrasound, blood tests including tumors marker like CA99, and sometimes a biopsy where a small sample of your tissue might be taken to run the test just to confirm if you have this cancer or not. Diagnosis usually requires combining multiple tests. You see, diagnosing this pancreatic cancer is kind of a build sound. We like to say tricky because it requires comparing multiple tests together. Now, for those of you wondering, can this cancer be treated? Well, the answer is yes, but it depends on how early this cancer is found. Treatment options include surgery. If caught on time, it can be surgically removed. Chemotherapy, radiation therapy. The problem with pancreatic cancer is that only a small amount of cases are caught on time for surgery. I explained earlier on why it is like this, because there is no screening test, early screening test for this pancreatic cancer, and it's not something that you can easily detect, like tumor that you can easily detect, because it sits inside your abdomen. So it's not something that you can easily see and detect, and it doesn't show symptoms like other type of cancer. Before symptoms start showing, this cancer might have spread. So it's very difficult to detect early. Now, for people that are at risk of having pancreatic cancer, if you have diabetes, you are actually at risk, reducing because this high sugar content or blood sugar can actually damage your pancreas, can damage the cells of your pancreas, and this can cause you harm. Another one is that if you smoke, you're a smoker, you're at risk of having pancreatic cancer. When you smoke, you're indirectly introducing toxic chemicals into your body. These chemicals don't just stay in your lungs, they travel through your bloodstream and enter several organs in your body. Eventually, they reach the pancreas. Over time, these toxic chemicals can damage the DNA of your pancreatic cells. These toxic chemicals can actually cause cell mutation. And once the DNA starts damaging repeatedly, that's how cancer begins. So it's not just all about smoking is bad. When you are addicted to smoking, you are slowly damaging your cells. your tissues, you are damaging your DNA, and this can result to cancer. Now, all these risk factors, including smoking, diabetes, chronic inflammation, obesity, they either damage the pancreas or stress cysts over time. And when cells are consistently being damaged and repaired, the chances of cancer developing becomes higher. This is why you should quit smoking. If you're a smoker, you are putting yourself at risk of having cancer. Not just pancreatic cancer, but liver cancer, any type of cancer. If you're obese, you're putting your health at risk of having diabetes. If you're diabetic, you're also putting yourself at risk of having pancreatic cancer. And that is why lifestyle habits actually matter. It's very, very important to look at your body, look at what you consume into this body, what you eat, if it is full of chemicals, because those small, small habits either is going to protect your body or slowly increase your risk of having cancer, even without you noticing. Now, listen up, pancreatic cancer is deadly not because it is unbeatable, but because this cancer is silent, aggressive, and often discovered too late. That is why awareness is very important. Listening to your body. If you notice any sign or symptoms that I mentioned in this video that is persistent for months or for years, rush to meet your doctor, go to the hospital and explain to your doctor. Let them run some screening tests on you. If you find this video helpful, don't forget to give a thumbs up, like, subscribe, and share. Bye.